quality care, right. I mean, that's the end, at the end of the day, right. Quality staff is what makes a difference to quality care.
So in many ways, like part of the vision of health centers we're trying to frame for the next 50 years, because we want to make sure all health centers are the employer of choice, the provider of choice, and the partner of choice. So you reflect on that, like employer of choice, in many ways you have to be competitive in terms of salaries to retain and recruit staff. And you need the diversity of the disciplines that represent the communities you serve. That's right, that's right.
So
yeah.
I think it all connects.
Yeah, that's a big thing in the movement. So there are over 300,000 people employed at health centers across the nation. We're the largest primary care system in the country, serving 1 in 11 Americans, over 31.5 million. That's based on 2022 data. So it's so important. Those 300,000 who serve have a lot of heart, right? They're very mission driven, but it's important we get the resources, whether it's ultrasounds or other, diagnostics that you might need here, but also your pay has to be strong, right? It has to be competitive to retain and recruit the best talent. The challenges in community health centers is you're focusing on people beyond the exam room, like you're helping them out with other resources, right? Or some people call it social drivers of health or social determinants of health. And as you look at opportunities that you do in the exam room, right? The vaccines, the drugs, the diagnoses, the tests, but then look and help them connect to resources in the community, right? To address those broader transportation, broader social drivers, job training, other things. So that's where the goal of being a partner of choice for all health centers is really important, because often you got to go beyond healthcare. Let me ask you a question. For primary care, which is what you guys do, if you had $1, how much do you think goes into primary care in our country? So here's $1. If this was all the healthcare spend in the U.S., how much goes to primary care? A nickel. Yeah, and only in New York, actually, you look online on the Millbank scorecard, state scorecard, it's 4.1 cents. You know how much we're spending per person on healthcare in the U.S.? It's about $13,000 to $14,000 a year per person. So if you think about healthcare, it's like all these different pieces: Medicare, Medicaid, employer-sponsored insurance, commercial, all of that. It averages for 360 million Americans about $13,000 or $14,000 a year. But we're only getting 5% of that, right? So that's well, and also imagine, like you said, if you take care of them and find all these problems and prevent them from being hospitalized, you're actually going to save money. So in the current legislation, the Congressional Budget Office for the first time said health centers save money. So this will be important over time. So it says that if we spend $1, we save maybe 20 cents, but I believe strongly the more evidence we show, will show that we even save more money than that. But if you give us the money, we'll keep people healthy out of the hospital, and then we'll save the system money.